Hi, my name's Dr Sarah Wright. I'm a private GP in Birmingham and I have an interest in dermatology. I'm going to talk a bit today about eczema, which is a really common skin problem affecting lots and lots of people, ranging through all ages from children all the way up to adulthood. So what is eczema? Eczema is a condition of the skin where there is inflammation, and typically people may have heard of it causing red, itchy, dry skin, and this is in fact how eczema tends to present. It is patches of the skin that often look and feel dry to the touch. They can look red and inflamed, and it can be very irritating and itchy. It can also be sore. Sometimes it may get infected and it could become a little bit weepy, and in rarer cases it can become infected with a virus or something else, which makes it a lot more painful and more serious. What treatment options are there for eczema? So eczema, like most medical conditions, can be treated through a variety of ways, and we often as doctors like to start with lifestyle treatments. So we would always want to assess looking at somebody's stress levels, their environment. Are they doing a job, for example, that might be making things worse, coming into contact with, for example, chemicals such as a hairdresser that might be aggravating their eczema. Occasionally people have used hair dyes that might cause eczema. There are lots of different triggers, but by far and away the most common type of eczema would be atopic eczema, which is an inherent eczema which is caused not necessarily through any known trigger, and there can be genetic tendencies with this kind of eczema. It may run in families, and people may have it from a young age sometimes. So also, eczema can sometimes be linked to allergies. This again can happen from a young age. We can see eczema breaking out in babies if they have some kind of milk allergy, for example, and all the way up to adults, which often people who have something like hay fever may also suffer with eczema. And the same is true for asthma. Eczema, hay fever and asthma are all linked into a group of conditions called atopic conditions because they have a common link, and people often have one or two of these, and they often run in families. So looking at environmental triggers such as dust, looking at controlling inflammation and other problems such as hay fever would also be relevant. But what can doctors do to treat eczema? So if eczema is getting out of hand or you are struggling to manage it, doctors would obviously want to assess your condition, looking at your history, your lifestyle, whether you have any triggers that might be making it worse for you. Also looking at whether there might be any allergy type triggers. Sometimes we might ask you to keep a food diary and look at whether certain things make it worse or better. And we would then talk about medical treatments. These can start from creams that are called emollients, or otherwise known as moisturizers. These are to add moisture to the skin and repair the skin barrier, which often gets compromised because of the inflammation. If moisturizers or emollients alone are not doing enough, often used in combination with what we call a soap substitute. So soaps can make things worse because they're drying and they strip the skin of the natural oils. We would then start to look at other treatments such as steroid creams, which are anti-inflammatory, and we have something called a steroid ladder. We often start with the lowest possible strength of steroid we can, which will be effective to treat the severity of eczema that is presenting at that time. In addition to this, if these simple measures plus reducing overwashing, reducing soaps or reducing chemicals, and then using these treatments such as moisturizers and steroids are not helping, we may consider whether allergy testing is relevant, and also we would always think about if eczema is becoming severe, causing severe distress or problems with quality of life, referring on to see a specialist, as sometimes stronger treatments through oral medications which work with the immune system may be needed.